low blood flow is the number one brain imaging predictor of Alzheimer's disease.
But you're the first one through my research that seems to be very clear that caffeine does have a significant cost.
It's a drug. I want to teach my patients skills. I don't want them to just take pills. And caffeine's a drug.
If I was intent on damaging my own brain, what would you advise me to do?
In the book, I talk about a mnemonic called Bright Minds. You want to keep your brain healthy or rescue it, you have to prevent or treat the 11 major risk factors that steal your mind. So, if you want to damage your brain, Bright Minds. The B is for blood flow. Low blood flow is the number one brain imaging predictor of Alzheimer's disease. How do you get low blood flow? Caffeine.
Oh, shit.
Nicotine, marijuana, alcohol, having a sedentary lifestyle, being overweight.
Can we pause on this low blood flow? You are the first person I've ever spoken to who has a comprehensive and very believable hypothesis that caffeine has a side effect. I think people refer to caffeine often as like this miracle drug that comes with no cost. But you're the first one through my research that seems to be very clear that caffeine does have a significant cost.
It's a drug. It's the most common drug. It's addictive. I mean, a little bit's fine, but more than a little bit is not fine. It increases cortisol. You don't want to increase cortisol. Puts fat around your belly. It shrinks your hippocampus. But, the reason I started really paying attention to it is on SPECT, the study I do, which is a blood flow study, it constricts blood flow 30%. I have all my patients hold caffeine the morning of their scans because I don't want it to artificially show me they have less blood flow than they really do. It fakes you out to think you have energy. What it does is it blocks adenosine, the chemical that tells you to go to sleep. And so often people rely on caffeine because they're sleep deprived, but it's just this bad cycle. And so many of my patients stop. Uniformly, they tell me they feel better.
You talk about one particular patient in the book who was struggling with a variety of difficulties. I think it was like brain fog and memory issues and so on. And one of the things you advised him to do was to cut coffee.
Jeff.
Jeff.
I remember Jeff. He was a pilot, and I live on caffeine. I'm like, you got to get rid of it because his brain looked terrible. He's like, all right, I'm going to do it. So he didn't get headaches. We cut it down by 5% a day. So 3 weeks it was gone. He didn't have any withdrawal, didn't have any headaches. He's like texting me, unbelievable energy, unbelievable clarity.
Do you drink caffeine?
A little bit, not much.
How much was Jeff having?
Jeff was having about 600 milligrams a day.
Jesus.
Which is 2 venti Starbucks. 1 venti Starbucks is 330 milligrams of caffeine. It's a drug. And why, I want to teach my patients skills. I don't want them to just take pills. And caffeine's a drug.